Sitting on your wallet is one of the most overlooked causes of back pain, neck pain, and even headaches. This is why I use the Ridge wallet. As you can tell, it's streamlined to be in the front pocket, it's that thin. And one of the main reasons what people don't realize why sitting on that thick wallet can lead to that neck pain, back pain, or even headaches, it's because when you're sitting and you're sitting on that big, thick wallet, you're causing a pressure shift. So the hips start to get imbalanced, which then imbalances the lumbar spine, that low back, and can tend all the way into the head and neck area as well. This is the Ridge carbon fiber wallet. They've got actually many different styles that you can choose from. If you guys put in the promo code of Y-strap, you'll be able to get a 10% discount on your purchase, lifetime warranty on. So scoliosis, correct?
Yes.
All right, and I know as you guys were saying, so your back has been bothering you since you were like 7 or 8.
Mm-hmm.
But she wasn't first diagnosed with scoliosis until she was, what, about 14, you said?
Mm-hmm.
Okay. Actually, let me have you stand up. So I'm going to have you turn around. So now the one thing, especially where you really notice, which I just want kind of everyone to see. Now, all of your pain is on this right side, correct?
Mm-hmm.
Okay. Let me have you just slowly bend forward. And so what you're noticing on the right side, all through here, her ribs are protruding out like this. And then on the left side, it's going more in. So what's happening is her entire rib cage is rotating like this. So, come on up. So what we're going to be doing is we're going to be doing, especially a little bit more, we're going to do some drops on that right side to bring the ribs down. And then also when you're on your back, we're going to do drops on the left side to bring that rib cage back. Now, besides all the pain on the right side here, what else are you feeling? Like what on a day-to-day basis?
A lot of tightness in my shoulders and neck.
Okay.
And between my shoulder blades.
Okay.
Those are like the biggest. And then also my
anything else?
my lower back too. It's like I can feel the imbalance like when I sit. Like it's like one of my like one side of me is like higher than the other.
Okay.
So it's like when I sit down for a long period of time or stand up, it starts to hurt.
Gotcha. Okay. Let me have you lay face down on the table for me, please. Good. Okay, so we're going to start off. We're going to scan the body. We're going to go from the cervical spine here, checking the leg length, and we're going to check the symmetry from that right side to left side. So as I palpate down, let me know if anything is painful or tender.
Right there.
Right in through here? Okay. Feeling things move already. Okay. Any pain in that low back like this?
Not really when you do that.
Okay. So we're going to check the leg length. So as you can tell, her right leg pulls short here. Actually, if you want to come over, take a look at. So do you see how her right leg pulls short like that?
Yeah.
So that's
wow.
that's
amazing. Different.
Yep. So and that right leg pulls short. So the left hip is up just a little bit higher here, but it's really right in here is what you can tell and what you can see a lot of. So I'm going to start off, I'm going to use that massage device. I just want to relax things and then we'll start with the adjustment. Let's go ahead and get started here. Take a deep breath in and exhale out. Good. One more time. And out. Good. Okay. So what I'm going to have you do, I want you to scoot down on the table just a little bit. Yes, right there. And if it's easier, you can bring your arms, to your side. A little bit more tension. Okay. Okay. Now these aren't the most comfortable adjustments. But with this, because that right side is,
Oh, yeah.
so. Okay. Let me have you sit up on the table and then straddle the table. Bring one leg on either side. Good. I'm going to bring one arm up and over. Bring the other arm up and over here. Good. Keep your thighs to the table there. So here we're going to rotate you this way. Yep, look over the shoulder for me. Good. So for you, that right side is what we need to focus on. But, you know, when we have that curve there, we're also going to have a curve here. So we're going to do very low on that left side. So come all the way down here. Good. Okay. Lay face down again for me, please. Getting better.
Way better.
Already. Okay. So we're going to stabilize on the sacrum. Raise your right leg up for me. Any pain with that?
No.
Good. Relax that side. Raise the left leg up. Any pain with that?
No.
Good. Let me get you to flip over and lay on your back. Okay. Relax your legs for me, okay? Actually, sorry, while you're right here, scoot down just a little bit. Good, right there. Okay, so when we had you the other way, we were bringing that right side and pushing it down. So what we're going to want to do, we want to bring that side back. A little lighter. Okay. And hands right there. Good. No, you're just relaxing it, because we were bringing this side. We want to bring it up, so we want to bring that side down. I know, same with these. Are probably not the most comfortable. One more though. Good.
Just a shock.
Yeah, come on up. Okay. Turn and face that way for me. Good. Bring your arms up. Bring your hands up and over mine. Okay. Yep. Squeeze your elbows. Good, good. Good, good, good. Perfect. Okay. Take a seat right here. Facing that way. I'm going to bring one arm up and over. Yep, other one up and over. Take a deep breath in. And exhale out. Good. Already released. Okay. Relax right there for me. And actually, Mom, I could use you.
Okay.
I'm going to have you just kind of holding down.
Okay.
Right there for me. Just because you're thin, you're light. You're just gonna fly right up the table. So I'm gonna have you held down just a little bit. Lift your head up for me. Good. There we go. Okay. And breathe. Deep breath in and out. Deep breath in and out. Deep breath in and out. Oh yeah, it's shocking. And breathe. And breathe. And breathe.
Oh my god.
Yes.
Wow.
Relax. Lay there, lay there.
Oh.
Yeah. You're not moving right now. There you go. Powerful technique, wasn't it?
Fair.
Relax. Catch your breath. We're not moving on. There it is.
I see in your videos every time you ask how that feels. It's like a straw, like
Yeah,
one of
the
those
little
bendy
bendy
straws.
straws.
It's like that. It's just.
I know, relax. We're not in a hurry, we're not rushing it. Like, when I tell people, like, this is a very powerful technique, like, trust me, I'm not kidding.
Yeah, I've seen it over and over again. I was just amazed that it was even possible to do such a straightening
Yeah.
of the spine so quickly.
Yeah, but in, like, her case and in her scenario, because of the spine, how, you know,
Yeah.
the lateral flexion, like how much it is bent in, you know, in what you're noticing, you need a little bit more aggressive of a technique.
Gotcha. Thank you.
Was this a little bit different than?
Oh yes, definitely. I feel like, just like with the chiropractor I was going to before, it was one of those chiropractors where they like do one patient after the next. It was like an open adjustment.
Yeah.
And I just felt like nothing. Like she wasn't really focusing on like what I really needed.
Gotcha.
Like, she was just doing the same thing over and over again.
Gotcha, yeah. Works for you, for all. When you have, especially like to your extent of the scoliosis, it needs to be a little bit more specific on things, but that's why, especially with the ribs, when we did those. But here, let me have you sit on up.
Oh, wow.
And
Oh
then,
my goodness, Lexi, that's
and then if you wanna,
so much.
just, so I know, Mom notices it quite a bit. I know. Well, you felt
Yes.
while you're laying there. I know. Trust me, you were almost like in a shock for a minute, like because it's a powerful move. But
Oh, yeah.
trust me, I see every reaction in here. Nothing phases me. Trust me, I just tell people breathe and breathe,
Breathe,
and let
gotta breathe.
and people, it's like you forget to breathe after.
Right, breathing is up.
Good. Stand up. How are things feeling?
Oh my god, it feels so much better. Like it just feels so much lighter. Like I feel like it's almost like you don't realize how much stress is there until it's all gone, but it feels significantly different.
Good. Good. That's what you've been eating. Now, granted, the scoliosis isn't gonna just magically up and go away, especially after one treatment.
Right.
Of course.
But at least now you realize that symptoms of the scoliosis are completely manageable. Like, as you can tell, you know, when having it, you know, you're getting a lot of pains, and I know for you it was more all that right-sided pain. So at least, you know, now it's, you know, without the use of like drugs, medications, anything like that, you can actually, you know, still live a normal life. Like, it doesn't have to make you only do, you know, live.
Or have to go to surgery.
Correct.
Right.
Correct. Yeah, because once you do surgery, I mean,
It's just
you-
like your last resort.
yeah, you've got all the risks and that.
And then nobody wants to touch you afterwards if it doesn't work.
Correct. Correct.
Mm-hmm.
So, at your age, definitely, you know, I would be going with this route. Now, granted, you know, when you're older and everything is still very painful and you know, if it has gotten that much worse, then, you know, at least you're out of like your youth. You know, because you don't know. And, you know, like I tell every patient, like, there's a time and a place when someone needs, you know, a surgery. And the thing is, unfortunately, if something happens when you're young, that's it.
Yeah.
Like you said, no one's going to touch you after, and that's it. So
Yeah.
if we can, you know, let
Manage
you,
it.
yeah, if we can manage it and let you live, you know, a normal life, you know, without pain, that's what we're going to do.
Of course.
Yeah, absolutely.
Yeah. How are you feeling?
Good
Let
still.
me see, what are we? Let me make sure I remember. All right. Headaches, neck, shoulder, upper back, middle back, lower back, hips. Give me a rundown. How are things feeling? What do you?
my neck just feels less, like there's no tightness anymore. Like I just feel like I feel more balanced. Like I have my footing. Like I often like times like feel like I can just get pushed and then fall over just because like I don't have my balance a lot of the times. But I just feel really good.
Okay. Perfect. This is how she needs to feel
Yeah.
all the time. So
Recommendations on the frequency?
about 4 times a year is what I always
That's-
recommend.
I was just about to say, what, 4 to 5 times a year?
Yep. So roughly right around every 3 months.
Okay.
Granted, everyone is a little bit different.
She's still young, growing,
Mhm.
baby, you know, still bones kind of a little malleable, you know,
Mhm.
to an extent.
Yeah.
So hopefully this will play a role in fusing.
Yep.
together
Straightening everything
properly.
out. Correct. Because at your age,
Yeah.
you know, things probably haven't fully fused yet.
Mhm.
So
Mm.
we'll get you
Okay.
better.
Thank
All
you
right.
so much.
Perfect.
Thank you.
You're welcome.
Thank you.
Nice meeting you.
Yes. You're welcome.
You're welcome.